morning and welcome to Cori Villegas, legislative candidate from District 14. Thank you, Cori, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers Susan DeCamp, Danny DeLong, and June Ryan. We also have the privilege to have with us this morning AARP Nebraska State President David Holmquist. Emily Wick is also joining from the AARP office to assist with technical details. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Cori, we appreciate your taking the next 30 minutes of your time to meet and discuss issues of importance to the 50-plus voter and their families in your district and across Nebraska. As a little bit of background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So with that, Cori, if you want to start us off by giving us a little background about yourself and your campaign, and generally 5 minutes or less on that would be great. And once we've completed your opening, we'll move into the questions. So welcome, Cori.
Hi, so I am running for District 14. I am not originally from Nebraska. I am from Hawaii. I'm a military brat. So Dad made the Air Force for 20 years and I decided to stay in Nebraska because I came here for Creighton. I went here for college, stayed here, and I loved it here. I didn't want to go back to Hawaii versus it's also very expensive, first of all, but the people here are super nice. And after being in the workforce, I used to work at a day center. So I dealt with adults with mental and developmental disabilities. And I decided to work at the hospital. I worked at a clinic. I worked with children with autism spectrum and severe behavior. And I started seeing that there's so many different opportunities. The government could be supporting our clients and our workers a lot more. So I decided, you know what? Maybe I should actually go for legislative. Like, I knew a few people in the House and they're like, yeah, you can do it. I was like, I never did politics, so here I am. So that's a little brief intro about me, and I am working on towards protecting your public dollars, making sure all the tax money you guys put in comes back to you as a citizen. I'm also encouraging a lot of inclusive groups. As me, I'm Filipino and a woman, so I would like to encourage groups and communities as that. And I'm also for public schools. I have always been a public school. The only time I did private was college, which is probably the most expensive choice ever, but I loved it and I want to continue students and kids to have an education here in Nebraska. Less than 5 minutes.
Welcome. Yeah, that was great, Cori. Welcome and thank you for sharing your background, your history, and of course your campaign priorities. We really do appreciate that. We have provided you with a set of 3 issues containing 4 questions pertaining to the 50 plus in Nebraska. Again, due to our time constraints, we're allotting about 5 minutes for each of those questions. So our first question this morning is on health, caregiving, and home and community-based services. And Susan DeCamp will take that one. So go ahead, Susan.
Thanks, Gina. Good morning, Cori. It's
morning.
nice to have you with us today. So home and community-based services, also known as HCBS, provides an array of services to help people with daily living activities that promote independence and allows them to age in place in their own homes and communities and delays them having to go into institutional care. Family caregivers also provide care for someone who is not able to live independently. And these caregivers are family members, friends, or acquaintances who often provide this care without any pay. We have found that telehealth services can be significant for seniors, particularly in rural areas or underserved communities. And they can also provide support to family caregivers by reducing their travel time, wait times, and costs associated with caregiving. So we have 2 questions for you on those topics. The first question, what will you do to support the 240,000 unpaid family caregivers in Nebraska through policies like enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket expenses? The second question is, what will you do to protect and or expand the home and community-based services program, particularly in the area of recruitment and retention of a sufficient workforce and also adequate funding of the services that Nebraskans and their families rely on?
Well, to answer your first question, and oh, sorry, I apologize. To answer your first question, I definitely want to present the importance of ACB services. Again, I worked at a day center. I see what caregivers go through. I don't know to the true extent what they felt and how they deal with, but finances, I would love for the state to encourage more and provide bills that will provide more out-of-pocket services and decrease that amount for them, especially because they're unpaid and many of these caregivers don't have a full-time job. This is their full-time job and they are providing for another human being as well. That's their time, their emotion, their physical health, everything. They're putting it all together. And I understand that the adult is also living through their own independent life, but they're having another support too. So out of pocket, I definitely believe we need to start supporting in the state. So provide more bills for that. I will work with DHHS to provide and see how that deals with. I know a lot of programs, and also work with what changes need to be done, because there are some areas that are restricting caregivers and these adults with disabilities for getting the services and the financial needs that they need. So I want to make sure we see what is that is preventing, because we should not have anything to prevent from these services. And for your second question, again, I've been working with adults with disabilities before and I've seen it all. I also want to encourage mental and emotional support. So one thing I was really looking into is we did well checks. Now, these well checks were pretty basic, and I want to be able to do well checks to see how they deal with ADLs and as well as their IADLs. We use a different term in the day service program, but basically making sure that the programs they're doing is actually beneficial to the lifestyle of the person. Are they actually learning independent skills? Are they actually doing things, and is it beneficial at all? Because sometimes we're taking steps of how to do clothes or taking steps on how to do dishes, and things like that are small, simple skills that are actually beneficial, but not to everyone. We can't do a generic program for everyone. So well checks to check on that, and well checks to also see, is both people or everyone in the situation happy? Are they mentally feel supported? Are they emotionally supported? We need to make sure that we are encouraging a healthy workforce area to make sure that we can encourage more people to help out in this field. And I know that Nebraska and Iowa, again, coming from Hawaii, we did not have a system to where we're getting help from a family or from the state for helping a family member. We didn't even have senior homes. We just took care of our family member because they're there. But I saw the financial hurt, I saw the physical hurt, and sometimes even the caregiver ages out to where they can't support who they're supporting. So I definitely would like well checks. I would definitely like to see more bills. And I think we just got to show people how important it really is, because as much as Nebraska says we are for the elderly, it's not happening as great as it could. I hope that answered it.
Yes, great. Thank you for your answers, Cori.
Thank you.
Thank you, Cori. Appreciate your perspective on that. Our second question is, now we're going to switch into more of the institutional or the facility type of side of things, a nursing facility quality. And Danny DeLong is going to take that question. So go ahead, Danny.
Good morning, Cori. Glad you're with
Good
us
morning,
this
Danny.
morning. Over 20,000 Nebraskans require care in nursing facilities or in assisted living facilities. In the last several years, facilities have closed their doors, citing reimbursement challenges and staffing shortages. Nebraska will need an additional 4,700 more nursing assistants, LPNs, and RNs by 2028 to meet Nebraskans' care needs. Everyone, regardless of where they reside, deserves to be treated with dignity and respect, as you've talked about this morning already, and to have access to quality medical care. We know that better staff to resident ratios improve the overall quality of care and well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across the long-term services and support industry. Causes of workforce challenges must be identified and implemented to respond to the growing need for high-quality care. What will you do to improve the quality of nursing facility care for Nebraska residents, including addressing the growing long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement?
Well, first of all, we do hear that term traveling nurses a lot. And especially after the pandemic, that is something that's occurring. But these traveling nurses are getting paid more than the nurses that decide to stay here. And I believe we need to either put their pay at equal or figure out a way we can help those nurses that are in a way loyal to where we're at. And they deserve to be treated a lot better than these so-called traveling nurses. Now, I love having nurses anywhere. This is great. But these nurses who have been already established in the facilities and hospitals that we're at, they deserve to be treated a lot better. Also, the mental health, especially after the pandemic, serious burnout. Burnout is definitely a thing, and I know that goes compare with having a short staff problem. Now, if we were to show the nurses we have now the benefits and we treat them a lot better, that will encourage more people, for instance, students that are going for nursing or any healthcare field, to stay here in Nebraska, that graduate from Nebraska schools. We should also do better programs to where we can help guide these students in the training that is needed here in Nebraska and their actual state certifications. So if we help provide that, then we'll encourage them to stay, and we'll give them the support, and of course, more training that is necessary. Especially for me, I have my master's in forensic psychology, but even though I have my master's, it doesn't make me a psychologist. Now, if I decided to go to school here in Nebraska and get the board certification and get guidance on what Nebraska has to offer, then I'd possibly be able to get certified here as a psychologist and work at Nebraska facilities. So I think we really need to encourage that for our Nebraskan students that are going into the healthcare field once again, and also really, really encourage a better environment for the nurses we already do have. Help them provide programs for mental health, provide that programs for burnout, and don't just this goes for worldwide almost, is don't treat our healthcare people as just sticks in a pile of sticks, because they are here, they're actual people, and they're actually here to help. They're not sticks that just break into two for more sticks. We don't have that. It's not possible.
Thank you, Cori. I appreciate your detailed answers.
I know, sticks was the first thing that came to mind.
It works.
Thank you, Cori. Our final question for discussion today centers around livable communities and helping people stay in their home. And June Ryan is going to take that. So go ahead, June.
Thank you. Hi, Cori, and thanks for being with us today. We really do appreciate it. And I love your enthusiasm.
Thank you.
A livable community, as you probably know, is safe and secure. It offers affordable housing and transportation options that allow individuals to travel by multiple means and provide supportive community features and services for people of all ages, allowing people to remain in their communities as they age. And as you might guess, I'm one of those older people who is very happy to be staying in my home, and that's what I intend to do for the rest of my life, if possible. Affordable and reliable healthcare and transit options are critical to support older Nebraskans aging in place. High-speed internet especially should be affordable, reliable, and accessible to all Nebraskans. Digital skills development is also essential to obtaining the benefits of high-speed internet access in the home. Cori, our question for you is, what will you do to ensure that all Nebraskans, but mainly those 50 plus, have access to livable communities which offer affordable housing? That's almost a tongue twister. Offer affordable housing, diverse transportation options, adequate health care, and affordable, reliable, and accessible high-speed internet, including digital skills development.
Well, I have to say, I truly believe our tax dollars need to go back to our people, and being 50 plus, you guys are one of them. So definitely need to just put a part of that money into it. And when it comes to transportation, and I really had to think about this one because I recall Papillion having a special transportation services. And Papillion, it's by reservation, and it's a very small fee, and you can also have a caregiver with you if you are disabled for free of charge. That is something that my city has implemented, and I believe every other place should have something similar to that, if not expand it even greater, because that's, again, it's our tax dollars, it's going back to the people. And this is helping those elderly with transportation. My grandma doesn't drive, and she has a Mercedes that she does not want to give to me, but that's okay. She'll just have it at the garage, but she does not drive because she doesn't feel comfortable in driving. And she's lucky enough to have all of my aunties and uncles on that side drive her around. But I know my elderly uncles and aunties here, they don't have their children to do that. They're also not related by blood, by the way, so I don't feel too obligated to drive them. But anyways, they also they would use Uber and what's the other one, Lyft. However, not many other people know how to use that. For goodness sake, I don't even know how to use it properly, and it's also very expensive. So I really truly believe I will present bills and ways to find the best way possible to save our city and as well for our people to get transportation such as that. Now, when it comes to technology, I'm not sure if any of you guys are familiar with the Do It Center in Omaha. I see some heads, and that's another thing I really, really want to start. I want to get professionals, those who are willing to spend their heart and time into this, knowledgeable in technology, and also friendly enough and patient enough to teach other people, whether you're elderly or in the middle age, but specifically elderly, how to use a phone or how to even find the best type of technology to purchase. Just like internet, not many people know or understand what's Ethernet. Do I need to get the cable? Do I need to get a house phone? All of this. And that will be skills we need to provide at our local community centers or at our school centers and just teach that. I will be looking into professionals who will help into showing those skills, because as much as I want to teach technology, I don't have patience with my mother, so I don't know how that will go. So we'll definitely find people who can help and possibly work with the Do It Center. That is something I've always wanted to do as well. Also, internet. Internet is something that has become so necessity. It's basically our water. I will make sure we will get tax dollars to help provide all areas, work with OPPD or whoever needs to see, is this area capable of high-speed internet? If not, what can we do to get this area capable? What do we need to do to drop the prices down? Because everyone needs it. And even for telehealth, you need internet. If you need to be calling for services, let's say you can't do it on your phone, you're going to have internet. Again, internet has become our water, and that is what every citizen needs. And if you're going to start doing all of this other technology movement, we got to start with the source. We have to start with our internet.
Thank you for that well thought out and developed answer. I guess I would make 2 comments. One is
Sure.
that, there's kind of a standing joke. If you need help with the internet, go ask your grandkids. Well, I don't have grandkids. So, I rely on public services to help me go find answers. And the other, I know you represent a metropolitan area, as do I think all of us on this call, but I would make a pitch that there are many people, particularly in rural areas, that I think our state legislature needs to remember. And they're harder, particularly with transportation. I don't have answers to that question, but I think certainly with high-speed internet, the state has done a lot in recent times. And
Yes.
we certainly have some new money, which is wonderful, but we have a whole state. And so, I hope that you'll be sympathetic to my friends and family in Cherry County and Brown County up there who have more cows than people. But thank you very much. And I can
Thank
see
you.
you're going to be a real active, continue to be a real active participant in our state legislature. And thank you for what you do.
Thank you, June.
Thank you, Cori. As we now come to the end of our meeting time, I would like to offer back to you final minutes for any closing thoughts or comments that you might have for our members and of course the constituents of the district. So we have about 5 minutes left, Cori. So if you have any closing comments, go ahead and take the time to do that now.
Sure, I'll just do a little simple plug right now, but if anybody's willing to volunteer, I will be having a sign waves on 370 and 72nd next to Starbucks on Sunday. And if anyone's willing to knock on doors and help me out and just pass the word around about who is available in the area, I will be doing that next week as well. And please, please, please make sure you guys sign up and register to vote. That's just all I ask for. So there you go. And thank you guys for taking time out of your day. I know it's awkward middle of the week and not many people, this is when you start wanting not to work anymore. So I do thank you guys for helping me out here.
Cori, thank you again for taking the time to visit with us. We wish you the best with your campaign, and thank you most importantly for meeting with AARP today. Take care.
Thank
Thanks,
you,
Cori.
guys.
Bye.
Thanks, Cori.
Thank
Bye.
you.
Thank you.